Good morning. I'm Dr. Perry. Today, I'm here to answer some questions about dental implants that I get. These are some of the most common ones. And hopefully at the end of these videos, you'll have some of your questions answered on dental implants and what they are. What is a dental implant? A dental implant is something that we place down into the mouth to allow us to put a tooth on top of it. Usually we use it to replace a single tooth, but it can be used to replace multiple or even to secure dentures so they're not wobbling around on you. Dental implants are most commonly recommended when you're missing teeth, or if you have a denture or something like that that's just not holding down well. So let me compare dental implants versus some of the other things that you can use to replace teeth. When you have no teeth in your mouth, dental implants, the advantages of that are you can allow a denture or a bridge to be placed on top of the implants. Now, when it's a denture, it's something that comes in and out. It snaps onto the implants. We call that an overdenture. It works phenomenally well, especially on the lower. And sometimes we'll even go as far as putting a couple of implants in and a bridge on over the top. That's what we do when people don't have any teeth at all. If you have a couple of teeth or most of your teeth and you're really only needing one or two or a couple of teeth, then we'll put an implant in and put either a single tooth on top or like a bridge or something like that on top of the implants. What is involved in the dental exam when you have a dental implant placed? So like most exams in the dental world, we ask a million questions and it feels kind of like you're playing a board game or something. We want to know the medications that you're taking, any medical conditions you have, or any concerns that your doctor has. After we've reviewed those, we'll see if any of them are applicable to implants. Some of the most applicable ones, by the way, are any bisphosphonates. Like if you have osteoporosis, that can be something that comes up. If you smoke or if you have diabetes, those are things of particular concern for us as dentists when we're considering placing dental implants. How will I come up with a treatment plan that's right for you? Come on into the office. We'll sit down, we'll review the medical history, we'll talk to you about what you're looking to achieve, what your goals are in dentistry, and then we'll do our exam where we look individually at each tooth all throughout the mouth and see what is it that best fits your needs and your desires for dentistry. So what are the steps of having an implant in to replace a tooth? First step, we're probably taking out a tooth. We're replacing it, we need it out of the way. Clean it up, put the implant in, and graft some bone around that so the bone heals well. That heals that way for about 6 months, by the way. At the end of that point, we put on a coupler on top of the implant. It's called an abutment. It's kind of like putting the coupler on the back of your car to tow something. That abutment we scan where we make a digital impression of it. And about 2 months later or so, we have a crown custom fit to go on over top of that implant. And we usually screw them down or cement them to hold them in. They function great. At the end of this process, kind of a long process, it feels great. It feels like a natural tooth, and it looks about as close to a natural tooth as anything in dentistry can. Our purpose at Farmington Family Dental is to serve patients and employees and our community through dental excellence. Ultimately, we're looking to get people healthy and keep them there so they can live longer, happier, healthier lives as a result of that.